Chef AJ Live, thank you so much for being here. Today we have a wonderful medical doctor, and when we do that, you know what that means. Lots of questions. There's 10 pages of questions. I don't know if we'll get to them all. And so what we'll do is hope that she'll come back next month. And the reason she's here this month is because truly she is back by popular demand. For some reason, people love dermatology. They love asking questions about their skin, which makes sense. It's the largest organ in the body. And who better to do it than somebody who has beautiful skin, who's lovely herself, who's intelligent, and who's a plant-based dermatologist. And as you know, we always answer the questions that have been emailed to us first, guys. It's not because we don't love you and don't love your questions, but I'm broadcasting live to 5 platforms. You're watching on 1 platform. Therefore, I see 5 times as many comments as you that are going faster than the speed of light, and I can't always capture them. Whereas if you send us a question, I have it on paper, and that's why we ask to just, when you are on our mailing list, just reply. You don't have to be on our mailing list if you don't want to, but you do need to email your questions in, because actually we got some questions on Instagram today, and I wouldn't know how to get those to the doctor. So please welcome, without further ado, Dr. Jessica Krant. Thank you so much for coming back.
Thank you so much for having me back, Chef AJ. It's really an honor it's a huge compliment to be invited back. And I'm so appreciative to you and all of your followers for the enthusiasm. And it's, really exciting.
Well, I think so, because, not everybody has irritable bowel disease, but everybody has skin. And with the skin being such a large organ, there's so many things that could go wrong.
Absolutely. Skin is the one thing that not only do we all have skin, but it's literally the way we present ourselves to the world before we even say anything. And regardless of what our body language is, the skin is just there silently speaking for us. So you're right, it affects all of us. And I like to be part of helping people, present themselves confidently and comfortably to the world.
Right. Terrific. Well, then I'm going to start with this first question from Kimberly. And she said, she went to her doctor for her annual physical, and her doctor told her she needed to see a dermatologist once a year to get a complete skin check. I've never heard of this before, and I'm wondering why we have to do it, how often, and what exactly does that mean? Because I think a lot of people don't seek the advice or help of a dermatologist. It's not like the dentist where every 6 months they send you a card. I think they wait until something bad happens.
A lot of people, I would say most people do wait until something bad happens. And, if you're lucky, most of the time, that's probably fine. The problem is that you can't see everything on your skin, and you may not know when something bad is happening in an area that you can't see, or that you might not even be able to feel. So the American Academy of Dermatology has long recommended that everybody go for a once a year screening preventative skin cancer check, where the board certified dermatologist will check your scalp, your body, your feet, between your toes, areas that the sun don't shine very often, and even fingernails and toenails, and areas that we don't always realize could be involved in a cancer situation or any other skin problem. Dermatologists, people don't always realize that we are the experts in skin and hair and nails from a medical perspective. So we really check everything. We prefer to do it once a year to make sure that nothing gets missed.
Great. Well, maybe you could do like a mock exam with me. And so what I did today, guys, I'm only doing this once. I have nothing on. I swear to God, I have no makeup. I got nothing. And all I did was wash my face with the product that I love, which I'm trying to get sent to you. I interviewed the company last week. It's vegan and it's awesome. It's like having blueberry pie on your face. It just rubbed my skin. So what would you do? I come into your office, and what do you do?
Okay, first of all, Chef AJ, I have to tell you, as I mentioned before, it really looks to me like you have makeup on because your skin is so beautiful. You've obviously done a good job taking care of it. I'm going to get a little closer here and see if I can, spot anything.
I can make myself big if that helps. See, because I didn't cover up I have a mosquito bite. I have a little imperfection. I didn't do anything. It's, I'm my own worst critic. All I see is the little spots, and I don't wear much makeup since moving to the desert 1.5 years ago. I basically use like what's called a primer and a little powder just so I'm not shiny.
That's perfect. And before I comment on your skin and your skin issues, I wanted to say that a primer and a powder work well for a lot of people because they physically block the rays of the sun, like literally physically block it. So it is technically a physical blocker type of almost a sunscreen, even though it may not be called sunscreen. So I'm glad that you do that every day. It really helps your skin. I did notice a little bit of residual pigmentation issue, which we call dyspigmentation, which means bad or, inappropriate pigmentation. That can come from chronic sun damage. That can come from a combination of hormones and sun exposure, which we call melasma. And it's usually benign, but it may, in some cases, be a sign of a very superficial and thin type of skin cancer. So I recommend that anybody that sees light brown or medium brown or flecked brown spots, do at least go have them checked by a board certified dermatologist, because I know cases where people have just thought those were sunspots or sun patches that sat there for years and grew and turned out to be what we call malignant melanoma in situ, which means a very thin, superficial melanoma, but a true melanoma.
That's very good to know. Okay, so I passed the face test we see, and maybe if there's anything I can do for the residual sun damage. You're not going to like my arms.
Oh, those are very familiar arms, though. Those are the arms of a lifelong, sun exposed person. And what happens is when we're young and growing up, we just tan. And then as we get older, first of all, we start to get what I call a permatan, where there's just a brown patch across the arm. And it's a little bit, uneven on the edges. And eventually we realize white spots are appearing. And the white spots, yep.
Now look at this. I want to show you the difference between
the foot and the leg. That same pattern happens on the shins really frequently. And the white spots we call idiopathic guttate hypomelanosis. Idiopathic means they just appear on their own. Guttate means they're little flecks that look like raindrops. And hypomelanosis means decreased melanin. That usually is a sign of chronic sun damage to the point where now your natural melanocytes that create your natural pigment they're so wiped out, they can't even create pigment anymore at all, even your normal color, and they just stop performing and the skin patch there turns white. In other situations where it's more of a sudden appearance or really not congruous with somebody's history of sun exposure, it can be a sign of some other skin conditions and skin diseases. So if you haven't been told by your dermatologist that it's natural and from long-term sun exposure, it's a good idea just to get that checked too.
Well, basically, I actually am going to a dermatologist that's also a plastic surgeon now, and he was the one that read me the Riot Act when I moved here, and which is why I wear, the hat now that even before COVID, the one that covers your whole face and basically just your eyes are peeping out. He wanted me to wear long sleeves and long pants all the time, the Kula bar, but I mean, it's sometimes 122 here and it's kind of hot.
Yeah. So one thing I wanted to just say about the plastic surgeons who are also dermatologists. There are many plastic surgeons in the country who also do some dermatology services, especially around sun exposure and cosmetic treatments for skin, but only board certified dermatologists are trained to do formal skin cancer screenings and to really treat all of the other skin diseases. So if you get a sense that there might be something brewing and your skin doctor is your plastic surgeon, it's just a good idea to also make an appointment with a board certified medical dermatologist to really get everything checked again.
That is a very good point. I was actually referred to him by the dermatologist. So that's so interesting. Everybody's asking though, what about the brown spots? Can we do anything about them?
The brown spots are so tough. I really like to say it's a two-part answer, because if we do not absolutely halt the additional damage that's continuing to happen every day, it's almost impossible to make any improvement on the existing brown spots. So first we have to get really serious about sun protection, even like you said, a primer or a really major sunscreen, where use it religiously, reapply it, wear a hat with a wide brim, even gloves potentially, or long sleeves with a sun protective fabric, all of those tricks. Try not to be out in the middle of the hottest part of the middle of the day when the sun is directly overhead. It really does get us much more strongly in that midday period. And then if we have reduced the additional damage that's going on, we can start with skin brighteners, skin lighteners, the lotions and the serums. It may also take some laser treatments. It may take several laser treatments. It may take more aggressive laser treatments, which come with their own risks. And sometimes those spots are just very stubborn. They'll disappear for a few weeks and even a couple of months, and then they start to creep back and people can get very frustrated.
Right. Thank you. Thank you. Lucy says, what is the best thing to do for bug bites? The itching is so bad, I just can't keep my hands off them. Even when I'm sleeping, I'm worried they will create unsightly scars because I scratch them until I bleed in my sleep.
You know, this is the season. I have gotten a lot of patients now starting to get all the summer bug bites. And I have to say, it's really frustrating. The most important thing, if you can possibly manage, is to start scratching or rubbing at all. Once the scratching and rubbing starts, it triggers a histamine reaction cycle that just gets worse and worse. And when the bites are scratched so much that they're bleeding and scabbing, that's an additional wound on top of the original bug bite. And we all know that healing wounds get itchy, scabs can be itchy because the body is trying to heal itself. So I would say try to prevent the bites with various methods that are not always reliable. And immediately when you realize you have new little bites that are appearing, which may even appear as late as 48 hours after you've been bitten, don't be fooled. If you realize you're starting to scratch, pay attention and immediately put, I would say, a topical steroid. This is a kind of emergency situation where it may be worth a hydrocortisone or a stronger prescription topical steroid just on the bug bites themselves right away. Because if you can prevent the flare up of the itching, you really do most of the trick. One of my favorite natural treatments for itching and bug bites is cold milk compresses. Now, this doesn't work for 100% plant-based vegans, because the only milk that really works in this way is milk from cows. But if you're somebody that does have some milk from a cow at home, you can put milk in a bowl with ice cubes and let the ice cubes melt a little bit. It creates a watery, very cold milk solution that you put on a washcloth. You can put it on your bites or on your itchy rashes. It's totally safe. And milk has anti-itch qualities and anti-itch ingredients in it. So milk can take away itching and burning from bug bites, poison ivy, and a lot of other itchy rashes. And it's not a medication. So for some people, that's really helpful.
You know, I'm going to be getting lots of comments from the ethical vegans about this one.
I know. I know. That's why I said, I also am 100% plant-based. I don't have milk in my refrigerator, but there are some other anti-inflammatory herbal and botanical soothing lotions. Camphor and menthol are in a lotion called Sarna. So that might be an option. And anything cold, even if you just do ice water compresses, that may be helpful too. But the real trick is get in there early.
Right. Well, thank you. Yeah, because we don't edit these videos unless there happens to be like a sound problem or something. So thank you. Corey wants to know, how do you know what specialty to go to? My upper eyelashes on the right eye are falling out. I do not use any makeup on my eyes, so I don't think that could be the reason. I'm hypothyroid, but my thyroid is in check on medication. I went to the endocrinologist and he told me to go to the dermatologist. She looked at it and told me to go to the ophthalmologist. He looked at it and told me to go to the endocrinologist. So I feel like I'm on a medical merry-go-round. Do you have any advice for eyelash loss?
Eyelash loss is really tough because, it's visually uncomfortable for people to have to walk around like that. It's hard to know from your story whether it's a case of alopecia areata, which is an autoimmune hair loss that can be related to thyroid conditions, or can just happen on its own, or whether there may be something going on that's irritating the roots of the eyelashes, or maybe some, hair pulling a little bit called trichotillomania. If it's alopecia areata and just the eyelashes from the right eye fell out, you're actually seeing all of the right specialists, and there is no one correct answer for that. It may be helpful to see if you can find a dermatologist who specializes in alopecia areata, because not all dermatologists are hair loss specialists, and hair loss is quite tricky. So I agree with dermatologists. I agree with endocrinologists to make sure that all of your hormones are in balance, and just to keep seeking information with alopecia areata organizations and specialists around the country.
You are so smart. What's that stuff that the Latisse, what's this, is that okay? People are asking.
Latisse is, there are so many medications that are being used now for things they were accidentally discovered for. Latisse is actually originally was a medication for glaucoma, for high pressure in the eyeball. And they noticed when their patients were using it that their eyelashes were growing very long. So somebody jumped on that one patent right away and grabbed it up for cosmetic regrowth of eyelashes. And it is mostly safe. It will promote the growth of hairs that are already growing. It will help them grow for a longer period, which means they will grow longer. To a slight degree, it helps them grow a little bit thicker. But it probably does not jumpstart the growth of eyelashes that have fallen out because of alopecia areata. So it's probably not harmful to try it, but I wouldn't say it's reliable for that, because it's working on a completely different mechanism.
Areata almost sounds like arrabbiata, which is a cooking thing, So
I love arrabbiata.
Isn't that
One
fun?
more thing I wanted to say about the Latisse. There used to be concern when it first came out that it could turn people with a light eye color, it could turn their eye color dark, like blue eyes turning brown. That has not really been commonly noticed, or I have never heard of a real reported case of it. However, it really does do a couple of other things. One thing it can do is darken the skin of the eyelid, and that's not easily reversible. So if you're going to use it, just pay close attention to the skin color of your eyelids. It may get a little bit browner, and that's from the Latisse itself. The other thing it has been found to do is actually to dissolve and hollow out the area right under the eye. Now, some people may feel like they have a little fatty deposit under there and would like to try the Latisse for it. But I have to say that it's not that easily controlled. And the people that use Latisse long-term end up with a very hollowed out look under the eye. It makes them look ill and the eye looks sunken in. So if you're going to use Latisse, pay close attention to those potential effects and just use it for the bare minimum amount of time and then take breaks.
Wow, that is good to know, because we actually have a question about dark eyelids, and maybe that wow, you're really smart. Thank you. So here now, some more controversy to come. Elena asks, I have always had a very dry nose, so dry in fact it may bleed, and my dermatologist told me to just keep it moist with a little bit of Vaseline. Last week when Chef AJ interviewed Dr. Greger, he said it was very dangerous. If that is the case, what can I use on the inside of my nose? A humidifier isn't practical when I'm out and about.
As a dermatologist, I must say that I mostly focus on the skin that's visible on the outside. for the mucous membrane of the inside of the nostrils, it's really the purview of the ENT doctors, the otolaryngologists. So that's really who you should see. That said, I actually was watching the Dr. Greger's interview live with him walking on the treadmill with you, Chef AJ. And I heard him say that. And he was referring to the danger of putting Vaseline or any other oil-based or moisturizer-based substance inside your nostrils, because we might accidentally breathe it in. And even in micro droplets, it can get into the lung and create what he called lipoid pneumonia, which is a pneumonia that our body cannot clear out because we don't know, our body doesn't know what to do with oil droplets. We don't have a way to dissolve those. So I would say that if you were my patient, my answer would be to start with a humidifier inside at night and maybe have a little saline nose spray that you could carry around with you if you felt like the inside of your nose is getting dry. I think an ENT doctor may have more to offer because they may be able to examine reasons why your nose is so chronically dry inside, and possibly an allergist would be able to help you figure out if you are having an allergic reaction to something that is creating a chronic inflammation leading to the mucous membranes getting dried out.
Wow, thank you. I if anybody knows an ENT doctor, preferably plant-based, that would be fun to interview. So it's funny because you mentioned about the darkening, and Tammy says, do you have any advice for the skin darkening on my eyelids? I don't wear any makeup, so I don't know what's causing it. She doesn't say whether or not she has used Latisse, because people are saying, are the other lash things by Rodin and Fields and all the other companies, is it the same? Will that cause the same problems?
Great question. I'm going to take part 2 of that first. Latisse is the only the actual medication. I believe it's Bitamaprost, if I'm recalling correctly. Latisse is the real medication. All of the many of the other lash growing non-prescription agents that are out there that are very popular and really work use an analog of the Bitamaprost. So they kind of are sneaking around the FDA. They have what is truly, they won't call it a drug. They will call it a cosmetic, but it really does have an effect in a similar way to Latisse. So they are able to market it as a cosmetic, but it can have the same side effects as the real Latisse. That's part 2 answer. So use caution with those as well, and realize that they technically are working like drugs, even though they're being sold as cosmetics. And part 1, what is causing the darkness of the eyelids? This is always a really tricky one, and usually, requires an in-office or at least a video consultation. There are a lot of people in the world for whom some eyelid pigmentation is natural and is part of their healthy, normal range for their ethnicity, their ethnic background, even going a couple of generations back. So it's possible that the darkening around your eyelids is natural for you. It can be a little tough to battle. It's also a common area where people who have chronic allergies, even low-level allergies that they're not aware of, may get some darkening from chronic rubbing or chronic irritation of the eyes. If the eyes are chronically a little bit itchy or irritated, it creates a low-level inflammation around the eyelids that in some people with certain skin types can create a pigmentation that creeps up by itself.
Wow, thank you so much. Okay, Susan asks, do you know an effective treatment for Lanugo because waxing really hurts?
Susan, did you say Susan?
Yeah.
Susan, I'm curious where you heard the term Lanugo or read the term Lanugo, because I don't know if you're diagnosing yourself with Lanugo hair or that a doctor told you that this was Lanugo hair. If it's very normal for some people in some ethnic backgrounds to have a little bit more peach fuzz, especially on the face and cheeks, than others. So if you're referring to that normal ethnic peach fuzz, it's tough to manage. And I would say that there used to be a cream, prescription cream, that would, I can't remember the name of right now, that would help to reduce the hair growth of little fuzzy hairs like that. I agree that any waxing, pulling the hairs out, or epilating is really painful and can create ingrown hairs and rashes. So I would say if there are a few hairs that are worse, one of the more reliable ways to get rid of them without, laser is electrolysis. Electrolysis will individually put a little electrical current to the root of each hair and kill it. And I mentioned that first because Lanugo hair in many people is often fine and light colored and blonde or white, and laser won't attack white or blonde hairs. That said, the real Lanugo hair in an adult, the medical condition of Lanugo hair, can be associated with somebody who's not getting enough nourishment from calories or can be a little bit malnourished. And in some people, it can be associated with a diagnosis of anorexia. So I just wanted to say, out of concern, if this is real Lanugo hair that is excessive beyond your natural ethnicity, and you suspect that you might not be taking in as many calories as somebody else, and you want to talk to somebody about it, maybe, reach out to your primary care doctor and see if you can have a conversation about where to go from here and make sure that everything is healthy for you and that your, internal health is okay.
Right. Well, another reason to do that once-a-year skin check with your dermatologist so she can
That
tell you
too.
these things. Yeah. I hope if nothing else, people will know that we are supposed to do that. Okay, Molly, and Molly asked a question that I'm also seeing on the feed. Is there any treatment for thinning skin as we age? She says even the slightest scratch or bump will cause a very ugly discoloration or even bleeding. She's been on a whole food plant-based diet for over 20 years and takes no medication.
Well, I'm sorry to say that this is a normal and very common, pretty much universal part of aging. And I see it in my patients all the time. The best thing to do, maybe, anyone listening to this question who isn't already in the situation, to start slapping on the sunscreen and wearing the sun protective clothing now, because a large factor in skin thinning as we get older is chronic sun damage. Even though it may not show up right now, it accumulates and thins, breaks down, and sort of disintegrates the layers of the skin as we get older. Part of it, though, is hormonal and a natural part of aging, and we can't really avoid that, especially without something like hormone replacement therapy. So, two things that I can offer that are sort of a more natural approach. One is, I have recently learned, as we have all, that there's absolutely no danger in any soy food, especially whole soy foods, soybeans and edamame. So if you're heading into perimenopause and menopause, just make sure that you get plenty of soybeans and soy in your diet, because it does help to mitigate the symptoms of menopause. And it also helps to regulate some hormonal balance, which may protect the skin over the next few decades. That's number one. Number two, there are several moisturizers that are now aimed at thickening up this skin and helping it get a little juicier so that it can withstand trauma and damage a little bit more and is not so thin and fragile. One of them is a lotion called EpiMD. That's EPIMD, like physician. And it's actually, I have no financial affiliation with it, but it really is up-to-date technology that contains a lot of different factors and ingredients that all help to increase cell turnover and make the cells a little juicier and get them all back to a little bit more of a rubbery, mobile state, rather than what happens is they get a little bit dried out, like an old dried out rubber band. And then things break easily, tear easily. The blood vessels are a little fragile. I like EpiMD, and there's another one called DermMend, Fragile Skin moisturizing formula, I believe.
You know, maybe if you do come back, you could actually show us these products, you know, like visually show us the different ones you use.
Oh, sure. I could pick out some good ones to bring on.
That could be really, really helpful. So when going back to the waxing question, people are saying, well, what about, you know, shaving your face, a facial razor, or not microblading, but there's something that there's a technique they do. I can't think of it, but to remove it.
Right.
It's not waxing.
That I forgot the name of that too. I can't think of it at the moment.
Microplaning. I think it's microplaning.
Yes, yeah. Microplaning. Microplaning is safe. You know, it's just somebody taking a very fine, sharp little razor blade and shaving the hairs off. As long as you don't get cut, it's, you know, not a problem. I think that as we also get older, those little facial fuzzies, they do get a little more prominent. It's really just hormonal.
Oh boy, aging is not for sissies, let me tell you. That's what my mom said. Ben says he was just diagnosed with an MBT shoe allergy. Any advice?
I don't remember what MBT stands for exactly, but I do know that contact dermatitis allergies are really tricky and hard to live around and manage. I would say, you know, one option can be to look in the vegan shoe wear industry.
I looked it up. Mercaptobenzothiazole, allergic shoe allergy. Yeah.
Mercaptobenzothiazole, I believe, is in the family of the rubber allergies, and they're common in shoes because of rubber soles and rubber, you know, glues and things like that. The American Contact Dermatitis Society has on their website, they may have accessible to the public, the contact allergen replacement database. And if not, your dermatologist can access it. And you can put in your allergy and it will give you a printout in all different categories of personal care products and, you know, things we have to live with, of all of the things that you can use that do not contain the chemical you're allergic to. It's especially helpful for people who have multiple allergies. In terms of the MBT allergy itself, I can only recommend that you look for potentially, you know, more health aware shoe companies. I actually don't really know off the top of my head a particular company that doesn't use that, but I would start looking on Google myself to, you know, to see if I were able to help you. You might be able to find something.
Great, thank you. Tom says, I have a slight bump on my thigh. It is round and very thick, but you really can't see it, but you can feel it. Doesn't bother me. Occasionally it will itch. If I scratch it too much, it might bleed. My dog is obsessed with it and he's always sniffing it and licking it. And I'm starting to get concerned because I've heard that dogs can actually sniff out cancer. What does skin cancer look like and present like? And should I see a doctor for this? Also, is it true that when a dog licks you, it actually has an antibiotic effect? I love questions about dogs.
Yes, and I love dogs too. This is about 3 different parts, if I recall. Part 1 is I can't really answer about what the bump might be without looking at it. And even my just looking at it, even on a camera or a picture, doesn't tell the whole story. So I will answer about what skin cancer can look like in a minute. But my first answer is absolutely, please go see, ideally, a board certified physician dermatologist, because they're really best able to tell you what the bump is or what it might be. They may need to do a small skin test called a biopsy, which is not painful if they're unable to tell by looking. If the bump is just under the surface of the skin and you can't see it, it may be a completely benign growth, but it's possible that it's not. If it's itching you, if it has funny sensations, it may be something else. I think it's worth checking out. Skin cancer itself, real skin cancer comes in 3 different main types. There are also some other less common types, but skin cancer is a true cancer that technically, if left alone too long, does have the potential to be lethal. The 3 types of skin cancer are melanoma, squamous cell carcinoma, and basal cell carcinoma. Each of these types arises from a different cell that's in our skin. So they don't turn into each other. Melanoma is the most lethal and the most dangerous. But just because we have a milder form of skin cancer, basal cell or squamous cell carcinoma, it doesn't mean that they're benign. I hear a lot of people saying, oh, that's a benign skin cancer. And I just wanted to clarify that that's not a thing. But melanoma is really, potentially deadly. If it's very superficial and caught early, it has a very high cure rate. So this is why I urge everybody to get a once a year head to toe skin cancer check, just to make sure that you're not harboring a little melanoma or a little squamous cell carcinoma sitting there and not realize it. It's really worth getting it off early. Oh, the third part of the question about dogs licking. Dog licks are healthier than cat licks and bites, but it is not healthy or safe to have your pet licking a wound or, licking something on your skin and thinking it's medicinal is not really accurate. They still can harbor bacteria that are not healthy for us.
I wonder why they do it.
Well, I think they must know something is off or wrong, and they can sense it, and they are probably trying to lick it to make it go away, to lick it away or clean it away. It would be my guess.
Yeah. Well, I just got to say, you blow me away. Nirvana says, Dr. Krant has such an incredible knowledge base. There is no question she can answer. Amazing person. I agree. And she is plant-based, guys, because there was a comment about have a plant-based doctor. And I try to have pretty much exclusively plant-based doctors. And she is actually met her at a plant-based conference. So Esther asks, is it normal to experience hair loss as we age? She says she does not have any underlying diseases that she knows of, but now that she's in her early 70s, she doesn't have to shave her legs anymore because she doesn't seem to have any hair on her arms or her legs, and she is on no medication. Is this normal to lose body hair as you age?
It's normal. It happens to men and women, and the body hair just thins out and kind of goes away. Also, we notice, very elderly people usually have quite a thin little head of hair. And it's completely normal.
Well, that's maybe one good side effect of aging. You don't have to shave anymore, but that's probably it. So thanks. Okay, so this is an interesting question. I could probably ask this part of this question to Dr. Lyle next time he comes on, or Dr. Hawk. Tina says, I know that you're not a psychologist, but I'm wondering if you could please give me some advice for my 16-year-old daughter who has severe trichotillomania. She tweezes her eyebrows so bad that she often gets ingrown hairs and infections. Do you have any advice how to deal with ingrown hairs or the damage from the craters she's causing in her skin that often become infected? That's a tough one, isn't it?
Yeah. I would say this is a two-part answer. Part two, which I feel like I keep doing this today. Part two is my recommendation for the scarring and the ingrown hairs would really be to have her establish a relationship with a dermatologist if she can. Somebody she can really go to regularly, almost every 3 or 4 weeks if possible, because then she'll know that she has an ally and somebody who's going to be holding her accountable and be really looking at her skin and giving her some tips and tricks that she can do to try to keep the skin healthy. One of the things that happens with trichotillomania and any hair pulling or skin picking condition is that the brain is just this massively powerful device that wants to do this behavior and turns itself off so that it turns off our attention center in our brain so that we start the picking behavior and the brain is unable to recognize that we're doing it and to stop us. So one of the reasons that it's really valuable to have a regular relationship with a dermatologist is it creates some external accountability that will help her know that she can't just disappear into that brain fog and the picking and indefinitely go down that rabbit hole because somebody will notice. And if it's somebody that she has a good relationship with and feels that she, wants to show up well for and get a good report from, it really will help her to navigate that behavior from the outside in. Part one answer is a little tougher. Trichotillomania, hair picking, eyebrow picking, eyelash picking, and skin picking, which is not the same. Trichotillomania is the hair picking, but skin picking is also very common, especially around fingers and fingernails in our modern, highly stressed society. These behaviors are extremely difficult to handle on your own. And they're usually a sign of an anxiety that's just held within the body and some overwhelming feelings that are creating this behavior, which is a little bit avoidant and a little bit of a relief behavior, because when you can feel this sharp little pain, it's sort of soothing for the system. But it's obviously an unhealthy outlet for dealing with anxiety. Now we have systems like cognitive behavioral therapy, which is not like go back to your childhood and talk about all of your life, history, but it's really about training the brain differently to be able to recognize when you're in situations that are triggering this behavior. And it's been quite successful in helping people navigate through this. I think if it's possible for her to find a cognitive behavioral therapy specialist or other types of related therapies that are really more accepted in society and have less stigma, that may be a good connection for her to have too.
Great. God, you are such a wealth of knowledge. Have you ever seen these in your practice?
Oh, of course. Yeah, they're so common. And, like I say, it's almost normal in this society. People are under tremendous stress now more than ever, honestly. And everybody's just barely hanging on and trying to manage day to day. So I see these things all the time.
The thing is with the eyebrows, they sometimes don't grow back when people have that. I know a few people with that, but regular people, not that they're not regular people, but I mean, people do sometimes get an ingrown hair. And so what I wonder, different places, what do you recommend for that? Because they can be very annoying.
Yeah. Ingrown hairs are stubborn, especially in a time when it's not easy to get to a doctor. So what usually will cause an ingrown hair is when a hair is pulled out or cut too short, and either a new baby hair is trying to grow from the still alive, deeply placed hair root, and it gets stuck under the skin, or if we're shaving or some other kind of hair removal, the cut hair, when it dries, it shrinks and pulls itself under the surface. And then when it starts growing again, it can't find the exit. So any kind of hair grooming is really a risk for ingrown hairs. There's almost no avoiding it, especially in an area of the body where there's a skin fold under the arms or in the underwear area, where there's constant pressure from clothing and skin pressing on skin. The hairs can have a hard time finding their way out. So one of my tricks, they're really the most extreme trick, is to stop the hair from growing completely. And that would be by lasering or waxing. If the hair is trying to grow and you're trying to remove its visible portion above the surface, you're still at risk for ingrowns. The other trick for people who don't want to permanently laser or epilate, not permanently laser or electrolyze the hair away, is to trim with a trimmer and leave some hair visible above the surface, or to shave earlier in the shower before the hair has swollen and gotten soft. Because when we shave with the hair more like where it will be when we get out of the shower before it shrinks back, we're less likely to have the hairs pulling back under the surface. I didn't say that very well, but the later in the shower we shave, the more the hair has swollen. So when we first shave, we get an extremely smooth result for about a day or two, like smoother than ever. And what has happened is that those swollen, warm hairs have dried and shrunk back and pulled below the surface, so we don't feel them. That is the setup for a huge amount of ingrown hairs. So it's a trade-off.
Wow. Let's see. Dorothy, who is watching live, wants to know if you're currently seeing patients in your office in Manhattan.
We actually reopened this week. So I'm there Mondays and Wednesdays. And as we pick back up, as things go along, I'll be adding other days back into. But yes, I am back in the office.
And can you do telemedicine?
We were doing telemedicine the last couple of months. I'm not 100% clear on whether we'll still be offering it now that we are back open. Eventually, I will have some telemedicine platform that's, maybe in a different venue.
Thank you. Well, as the broadcast was in progress, my husband brought me more questions that just came in. So emailing is great, except that we still have 7 pages of questions, almost 30 questions we didn't get to. So I'll get to as many as I can. I know you're popular. Maybe what we should do is pick a date and not tell anybody so that we can next time answer as many of these questions as possible. But let me I try to do shorter ones a little bit because they're easier to read.
I'll make my answers shorter too.
Oh, you don't know, please. You don't feel like you have to do that because we love hearing your answers. I'm just saying I'm reading the shorter ones just because they take less time to read. So this one from Lori. What does Dr. Krant think of using coconut butter or coconut oil as a moisturizer for your face and body?
I love this question. Coconut oil and coconut butter are considered safe and perfectly fine to use on the body as a moisturizer for adults. Now, it should be said that it apparently may have some effect on raising cholesterol. If it's just fascinating to me, but they have found that using it on the whole body daily I believe it's raise LDL cholesterol, which is fascinating. So maybe use it in a smaller area or don't use it every single day. But I will say, please do not use coconut oil or coconut butter on your face because it actually it's a tropical oil and it's too heavy for the face. It creates what we call pomade acne, which is what is a kind of acne breakout we can get when we use oils that are too heavy, that clog the pores. And it's funny because I have a lot of patients who are trying so hard to be natural, use natural products and take very good care of their skin. And they actually are breaking out worse and worse. And they cannot figure out what's wrong. And it's because they're using coconut products on their faces.
What about, I've heard people use it as a makeup remover.
Oil is a great makeup remover because it is an organic solvent. So it can help to dissolve and remove some of the grease and oiliness of makeup. I think that if they do that and then they wash their faces, they're using the oil benefit and then they're getting the oil off. But I would not choose coconut oil particularly for makeup remover. There are many other oils that would work just as well and are not as likely to cause pomade acne.
Thank you. So this is a question for Christy. And she says, really enjoying your broadcast and I love Dr. Krant. Would you please ask her suggestions to help clear up large blackheads on the face, arms, and back of my 16-year-old son? He's very self-conscious of them, and I'm not sure how to help him. And interestingly enough, there's somebody watching live named Carol who says her 27-year-old son has cystic acne on his face, scalp, chest, back. Went on antibiotics for years. He tried eating clean, and that worked well, but it's not sustainable. Any advice? Well, it is sustainable, but that's just my opinion, that eating well and eating clean is sustainable.
Part 2 is clearly a Carol's son, a case of what we call nodulocystic acne. That is true, inflammatory, very stubborn, difficult acne that I will address. The first question with blackheads on the nose, cheeks, arms, and back, I can't exactly picture what that is. If it's what I consider blackheads, which are what we call open comedones, which is a raised bump with a little open pore that has black spot in it. and there really are raised bumps everywhere. That may be comedonal acne, and it's really common in teenagers. It's really triggered by the androgens, which are the male hormones, testosterone and others. So it's possible that he may need to see a real board certified dermatologist, potentially for a prescription of Accutane, that's the original brand name. It's called isotretinoin. It is a powerful medication, but it shrinks the sebum, sebaceous glands, and is one of the only treatments we have in some cases of acne. Same for Carol. Her son may also really need to do a course or two of the isotretinoin, which for some people is really a miracle worker. And even though people are afraid of strong chemicals and medications, these are really regulated, and for millions and millions of people have been used safely and have really changed lives. Now, back to nutritional interventions. There's now definite proof that our diet affects our tendency for acne, and an anti-inflammatory whole food, plant-based diet, rich in the rainbow of fruits and vegetables, absolutely helps the skin clear up and may clear it up completely. It's a long and tough road, and it's really hard with an unhappy teenager to get them to go through this. But I feel that avoiding dairy is number one, and trying to go as far along the path toward a whole food plant-based diet as possible would really make a huge difference, even before going to the dermatologist.
I don't know if you're familiar with the Nelson twins, Nina and Randa, who wrote a book called The Skin Clear Diet. I was trying to get them on the show to talk about their book, but they were raised vegan. And it wasn't until they really gave up all the added fats. They had unretractable acne. They are actresses and models. And they sought Dr. McDougall's help, and he put them on a no added fat diet, and their skin did clear up beautifully.
Yeah, there are a lot of factors that affect the skin. First would go dairy, which includes a lot of added fat. Then any processed sugar is also known now through research to be directly related to acne, because it creates a cycle of inflammation. And then as we are learning more, I think all of this nutrition science that we're getting now is so fascinating, and it's all, new to me too. So I'm learning along with everybody else. Oils and fats are inflammatory in our system. So if we're doing everything else correctly and we're still having problems that relate to inflammation, the oils and fats are going to go next, starting with the most processed, least healthy ones, and backing up toward the whole food, plant-based ones that we don't really ever want to completely give up. But there's a spectrum, and a good plant-based doctor would be able to guide you.
Great. We were talking about ingrown hairs before, and Kathy wrote live, can you use electrolysis for an ingrown hair?
Great question. I don't believe so, because the electrologist needs to be able to grab onto the hair for it to work. But I personally have never been to an electrologist. They may be able to get the tip of the hair if it's just under the surface. But I can't answer for everybody, because some of the hairs are very deep.
Right. This is I'm breaking my own rule, and I'm going to a live question just because I find it really interesting and I don't want to forget it. But Sharon says, as we get older, is there any advantage to sleeping on our backs rather than our sides to keep facial skin from sagging? She's a side sleeper and wondering. I'm a back sleeper, by the way. So.
Oh.
Do I have sagging skin?
Oh my gosh.
This? But
no.
Dr. Krant, I think of it as Ronald Reagan. I don't like this thing. I wish somebody would make a clip that I could just, you know what I mean? Go like this. Because I don't want to have surgery. I'm so scared, but I really don't like this.
So I also am starting to have that. I don't like it either, first of all. Second of all, they do have clips and tape that I know actors use for that, absolutely. So maybe we should do that next time. But And then last answer on the neck is that the moisturizers that I mentioned earlier that are good for thickening older skin so that it becomes less fragile, the Epi MD lotion and the Dermend moisturizing fragile skin lotion, neither of which, again, have any financial arrangement with, no financial conflict. I just think they're both good products that are very smartly formulated. Both of those contain the same ingredients that would also help to potentially thicken this skin a little bit. So I've started to try to do the Epi MD on my neck a little bit here and there, and we'll see if it works. But, you know, it'll be months and years of using it before we're able to tell if it has made any difference.
If I didn't live in the desert, I would just wear a turtleneck all the time.
Right. So back to, I think you said Sharon's question.
It's Sharon. It's our Sharon. If it wasn't for Sharon, we would never have met.
I was wondering if it was our Sharon. Hi, Sharon. I don't know if there's really robust, reliable, reproducible evidence that sleeping on our backs prevents our face from sagging. But it can't hurt. If you're able to sleep on your back, it's also great for your back. It's great for your body, and, more support for your spine and your neck. So if you're able to do it, go for it. I personally have tried a little bit in the last couple of months, actually, because my neck and back were hurting from sitting at home so much with this current situation. But the creases that we form sleeping on our sides, some people believe they're a little bit, they can become permanent. I don't know if that's true. I do know that our faces naturally age asymmetrically. It is totally normal because our faces are asymmetric when we're born, and that asymmetry actually becomes slowly exaggerated over the course of our lifetimes. It's completely normal. It has to do with how our embryos develop in the womb. But some people feel that, one side of their face being flatter or having a little bit more of a crease on that side is from sleeping on that side. And it's not necessarily true. It may just be our natural asymmetry.
Nice. Thank you. Well, I think we have time for one more question because I do like to try to keep it to an hour unless you specifically want to go over. Some doctors do, but I actually have another interview at 1, so I can today. I also do a lot of work for an educational company, and I have to interview doctors privately, which I love. I didn't go to medical school, but I feel like I'm getting an education now when I talk to all you smart people. It's like the thrill of my life doing this. Anyway, so I'm going to take this question from Laurel because the weather's getting warmer and I think it might help people, but also because it's her birthday. So if it's your birthday, I'll give you preferential question answering. So she says, we did discuss it a little bit, but she said that biting bugs are terribly attracted to her all her life, no matter what diet she's eaten. She is devoured all year round by mosquitoes, flea bites, spider bites, especially in the summer. She already has 30 mosquito bites, even though she's rarely outside due to sheltering in place. She's always covered up when she goes out, but they bite her right through her clothing. Is there anything she can do to repel the bugs that is more natural than DEET that would work? Something she can use to stop the itching? She can't stop scratching them. Or is there any new research on things she could eat that might stop the bugs or things she should avoid eating?
I'm sorry this is my last one because I don't have all of the answers for Laurel on her birthday. There are always little contraptions that people are trying to sell that repel bugs without chemicals. There's one that emits an ultrasonic vibration that's supposed to repel bugs that's worn as a bracelet. I don't know if that really works or not. As far as, keeping the bugs away, I really don't have a great answer for that other than, if it were me and I were suffering through this, I might even look on beekeeper websites and things for kind of like a net kind of a clothing that would keep the bugs away, a mosquito net fabric. Maybe somebody should invent it. Maybe Laurel can invent it.
Yeah. Well, she's an art teacher, so she probably would design a very, very pretty one. So anyway.
So Laurel, I would like to say I'm going to do a little more research on that for you. And hopefully next time I can give you a better answer.
She's a Gemini too. Did I miss your birthday?
My birthday was last week on, was it It was on the 26th.
Uh-oh, it's time for some California balsamic vinegars in the flavors of your choice. I'm so sorry I missed your birthday.
Oh
So
my goodness.
you're May 26th, right?
Right.
Next year, you'll be in my calendar. So that's great. You don't have to come back, but if we want to get to these 30 questions, I would love for you to come back next month. And if you want a monthly spot on the calendar or weekly, daily, you just tell me, because you're amazing. You just really know this topic.
Well, I'm honored and I'm try, but I do promise that if there's something I get asked that I truly do not know, that I will learn and then I will come back with the answer.
Well, I enjoyed this time. Maybe we can think of a name for it. Like Thomas from California Balsamic is doing a monthly with me. We're calling it Tuesday with Thomas. What can we call your show? The Skinny on Skin? I don't know. We'll have to think about it. Maybe if somebody comes up with a great name, we'll answer their question first. So guys, thanks so much for being here. Tomorrow we have a wonderful cooking demo from somebody who you may not know, but it's her 70th birthday. And she really wanted to be on the show during her birthday. And then we have another doctor named Diego Ponyman coming up on Sunday. So get on my mailing list so you know the schedule. Dr. Krant, you are amazing. Thank you so much.
Thank you, Chef AJ. It's always so much fun.
Take care. Bye.